Hello, I am Dr. Arghya Majumdar. I am the Director and Head of Nephrology at AMRI Hospital. Now, I'll start off with a story of one of my patients which we recently treated. This young lady, 45 years old, came from Nepal, and then she had a live-related transplant. And after that, one after another, we had problems. She developed parvovirus infection for which a bone marrow was suppressed, a hemoglobin was constantly at 5, and because of this infection we had to cut back on the immunosuppression, and then she developed CMV infection, multiple urine infections, C. diff colitis, and on top of that, because we have cut down on the immunosuppression, she developed rejection. So it was a massive challenge, and we thought that we may not be able to send her home and lose her. But one by one, with all the facilities at AMRI and with our specialized services of transplant and allied services, we managed to overcome each of these problems. And just yesterday, she went back to Nepal and is doing well. So that is one of the areas, kidney transplantation, which we are focusing on. And there we have transplanted patients not only from India but from Nepal, Bangladesh, Myanmar, and other countries. Uh, Other than this, we have a comprehensive nephrology service. Here we do general nephrology, outpatient services, diagnosis of all types of kidney problems. Besides, we have hemodialysis facilities uh, at all the ITU beds and in the hemodialysis unit with modern computerized machines. We have facilities for peritoneal dialysis where the dialysis can be done, and we have also done one patient of home hemodialysis where we arrange the hemodialysis at home. And besides that, one of our areas of special interest is critical care nephrology. All sorts of very sick critical patients are admitted here, and these patients with very low blood pressures can also be dialyzed. We have a special CRRT machine which only two hospitals in Calcutta have, and that is a special facility where patients with very low blood pressures and very unstable can also be dialyzed. Besides, we have sled machines for patients who are hemodynamically unstable but not that sick. And then we have our computerized machines for general hemodialysis. We have done a lot of unique procedures, some of them first time in Calcutta. We started plasmapheresis in a much cheaper way with our hemodialysis machine in special diseases like ANCA, associated vasculitis, and SLE. We have done charcoal hemoperfusion and then cytosorb, hemadsorption, other techniques in septic shock patients. And so, and latest was ECMO. So doing CRRT with ECMO is a big challenge and not done in any center in Calcutta yet. We managed to do this successfully, and so we are always trying to innovate and keep up with the latest advances, and whatever new techniques, new things are being developed, we try to update ourselves and uh, give that service, latest service to the patients. So we do try to provide very comprehensive uh, care of the kidney patient at AMRI.